welcome to Nursing Credits channel. If you are watching my channel for the first time, please subscribe the channel. Today I've done this video to share information regarding menstrual health. So this menstrual health is very important for women. So as a nurse and nursing students, we should be able to educate all the general teenagers and women. So what is this menstrual health? Nothing but it is about whether they are having regular menstrual cycles or not. So if there is any irregularity, you should be able to find out. And as a nurse, you should educate the general women and teenagers how to calculate this menstrual cycle. So they should be able to find out whether they are having any irregularity or not. So how we have to calculate, we'll discuss now. So first, I've given an example. A woman got period started on December 31st, 2022. And the next period is on Jan 38, 2023. And the next is on February 28, 2023. And the next period, that is on March 28, 2023. So I have taken 3 cycles. So how I have calculated this is, the criteria is, the first day of menstrual period is calculated as the first day. So what's the first day here? 31st. And 1 day before the next period, that is January 29th. So how many days? 30 days. This is one cycle. And the next one. So again, you have to take the first day of menstrual period, that is Jan 30. So you have to take the date 30. And 1 day before the menstrual period, that is February 27th. So how many days? 28 days. And next again, for the third cycle, first day of the menstrual period, that is 28th. So 28 to 1 day before the next period, that is March 27. So that is 27. So how many days? 28 days. So I have taken the 3 values. So here what you have to do next? You have to calculate the 3. So what is the count? That is 86. So here you have taken for 3 months. So you are dividing by 3. 86 divided by 3. So what will be the average? That will be around 28.66. So you can say that average menstrual cycle for this woman is 28 days. So like this, you have to calculate the menstrual cycle. So every month, the woman has to note down their menstrual cycle starting date. So it will be useful to calculate this menstrual cycle. So far we discussed about how to calculate this menstrual cycle. So what you have to do, the first thing is you have to record and monitor the menstruation dates. So you maintain a notes and you record all these menstruation dates every month. So it is useful to know about any irregularities in your menstrual cycle, and also this will be helpful to track the pregnancy planning also. So this is the main thing. And the next thing is safe use of sanitary napkins. See, we are using all different types of sanitary pads, right? So what is the care you have to take? So that is, you have to change the pads for every 6 hours. For every 6 hours, you have to change the pads. That is helpful to prevent the infections. So that is one point you have to follow. Whether the pad is full or not, you have to change it for every 6 hours. And in the market, many other products are also available, like menstrual cups, tampons. These are also available in the market. But what is the thing is, we have to insert this product into the vagina. Okay, so coming to the sanitary napkins, this is outside the area. We are using this. We are not inserting this sanitary napkins. And the most preferable is cloth sanitary napkins. Cloth sanitary napkins. They are breathable and it gives a better menstrual health. So that is, we prefer this cloth sanitary napkins. And the next thing, when to consult a gynecologist. So when you have to consult a gynecologist, if you have severe pain that is unbearable, and next thing is if there is any burning sensation, itching, and next if you are having bleed more than 7 days. Usually the menstrual cycle, they will have the bleed about 3 to 5 days. So if it is more than 7 days, then you have to consult a gynecologist. And next, if you are having heavy bleed, you have to consult a gynecologist. You should not ignore any of this point. So that is helpful to maintaining menstrual health. Avoid self-medications. See, usually the women, they will take painkillers. See, for every month, for period time, many were using these painkillers. This is not good for their health. So, if you are having unbearable pain, then only you have to go for painkiller. That too, with the consultation of a gynecologist. Avoid self-medications in the period. That is good for the menstrual health. Always consult a gynecologist. And the next thing is avoid smoking and alcoholism. They should not go for any smoking or alcoholism. And next thing is clean the vulval area. That is nothing but genital area, the private area. So how we have to clean this area? Always use the plain water to clean that area. Never use any type of soaps. Okay, see, usually there will be a natural pH and there is a good bacteria which prevents the infection. So if we use any soaps, what happens when we use these soaps? It kills the natural bacteria, that is good bacteria. So never use any type of soaps. And also in the market, many intimate washes are also available. So we can use this intimate washes, but limit the use of intimate wash. Okay, so this is the clean vulval area. So next thing is about diet. So what is a diet we have to take in the menstrual period time? So you can take all lots of vegetables and fruits, especially green leafy vegetables like broccoli, spinach, cabbage, cauliflower. These are good. And also you can take the calcium rich foods, milk, yogurt. This is good. And also many people, they don't take this curd, but it is good for menstrual time. They can take this either in the form of buttermilk also. They can prefer this. And also you have to limit the use of caffeine. And you have to reduce the use of salt. This you have to limit the usage. You can take all the things, and you have to take proteins. Chicken is good, and these are the things you have to take. You have to take all the fruits, vegetables, protein rich food, calcium rich food. These are all good in the menstrual time. That is the thing about the diet. And next is exercise. See, many women, when they experience this menstrual period time, they don't do any work. Many women, they immediately stick to their beds. It is not good. So during the menstrual time, you have to walk. You have to do exercises. It makes the relaxation of the uterine muscles. So I suggest all the women to do any exercise, walking, and also yoga. This yoga asanas are also good. They relax the uterine muscles and it reduces the pain. So yoga, exercise, walking, these are all good in the menstrual period time. They can do all this exercise, walking, and yoga. So these are some important points which you have to focus to maintaining menstrual health. So whatever we discussed is, first thing is you have to calculate the menstrual cycle to find out any irregularities or to plan for any pregnancy. The menstrual cycle is very useful. And next thing we discussed about when to consult a doctor and avoid self-medications and not to go for any smoking and alcoholisms, and clean the vulval area in a right way, and don't use this hot water also. You have to use warm water to clean that area. And also about the diet and about exercise, walking and yoga. I hope you understand this.